Hello, this is Dr. Trivedi, a doctor working here in this clinic. May I confirm your name and age, please?
Hello, doctor. I am Johnny Dave, 75 years.
Okay. Good morning, Mr. Johnny Depp. Okay. How may I address you?
Doctor, you can call me Johnny.
Okay, Mr. Johnny. Today we are going to talk about your health issues. Is that all right?
Yes, doctor, I want to discuss this issue.
Okay. And during our conversation, I might take down some notes, which will be strictly confidential. Will it be okay?
No problem with me, doctor.
Okay. And now, Mr. Johnny, can you please tell me in your own words what have brought you here today?
Okay, doctor. Actually, this is not a new thing. I am suffering from this for last couple of months. I have noticed that I am becoming less productive, less active day by day. Initially thought this was due to my age, but about 2 months ago, I noticed that I am becoming so much lethargic, so much weak, so much tired. Even I cannot keep pace with my friends. I feel lethargic. So I thought that there might be something abnormal with me. But somehow I then took rest. I didn't seek medical attention for that. I thought that it will improve. But the symptoms didn't improve. So I thought that there might be something abnormal with me. So I made an appointment with my GP.
Okay. I will. Yeah.
Okay, doctor. Then I
Okay.
made an appointment with my GP, and he ran some blood test and said that my blood level is significantly low than normal. He's thinking that this might be due to my long-standing high blood pressure. But I took the blood pressure medication regularly, so he cannot find out that what is happening with me, and he thought that I need further evaluation, so he sent me here.
Yes. Well, I will try my level best to find out what's causing your troubles. May I know that what do you actually mean by lethargy? Can you please tell me more in details?
Actually, doctor, am not getting mass energy like before. Just I start any work. After a few minutes, I feel that I am becoming weak. I cannot continue the job like that. Previously, this was not like this.
Oh,
Previously, I could do the jobs. Suppose I could manage my garden, I could water my garden, I could walk around my garden. That didn't make any problem. But now, after doing some work, I feel that I cannot. I am exhausted. I am not getting any energy.
can you please tell me that did this lethargy come along slowly or very quickly, suddenly?
Slowly, doctor. I told you that initially I thought it was due to my age.
Yeah, yeah. Can you please remember that uh, how frequent are these episodes now? Is it always present now nowadays? This
Always, doctor.
always. Okay. And do you think that there is any specific time of the day that you feel when you feel more
No,
lethargic?
no. All the time
Okay.
when I do any work, any work,
Yeah, yeah,
I feel.
yeah. And can you please tell me that is there again any specific condition when it becomes worse, like when you just stand up from sitting position or something like that, it makes
No,
worse? Is there
no.
anything? Okay. And is there anything that makes you feel better?
Taking some rest or sleeping, I feel better.
Okay. Okay. And okay. And may I know that do you feel any shortness of breath while being lethargic?
Uh, Not significantly, not significant, but a little
Oh,
shortness of breath.
okay. Do you need to use more pillows at night to feel comfortable while
No,
sleeping? Okay. Have you noticed any leg swelling?
no,
Okay. Any racing and pacing of your heart?
no,
Okay. And any chest pain?
no,
Okay. Any cough?
no.
Okay. Any chest tightness or noisy chest?
No.
Okay, that's all right. Have you noticed that is there any changes in your skin color recently?
No.
Oh, and how is about your weight? Has it been all right, or there is a change?
I think I have lost a few kg weight, and about 6 months ago, I last measured. I was 83, and yesterday at the GP surgery, it was 78. So around 5 kg I have lost.
Around 5 kg. Was it intentional or unintentional?
Unintentional, doctor. I didn't mean to lose weight.
Okay, that's all. And do you have any weather preferences? Have you noticed?
No.
Okay. And okay. And let me ask you some other questions now. And do you have any headache?
No.
Okay. Any changes in your vision or any vision problem?
No.
Okay. Any soreness in your mouth?
No.
Any difficulties in your swallowing?
No.
Any difficulties in speech?
No.
Any weakness in any part of your body?
No.
Okay. And okay. Any rich temperature?
No.
Okay. And may I know that what about your water work?
I haven't noticed any change.
Okay. Is there have you ever noticed any bleeding episode while doing water work?
No. But
Okay.
I think
Yeah.
I have noticed around 3 times stool, blood in my stool.
Yeah. 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 I will get to it. Now, can you please tell me that how is your bowel motion? Has it been all right recently, or has there been any change?
No, doctor. I have also noticed changes in it.
Can
Around,
you please tell in detail?
yes, doctor. This was also about for last 6 months. Uh,
Okay.
Usually, before that, I passed my bowel every day or every 2 days. But for last
Mm.
6 months, I noticed that it was somewhat deranged. I pass my bowel sometimes once every 3 days or
Okay.
sometimes once every 2 days. And also, I noticed that I feel some abnormal sensation also in my tummy, that I discomfort in my tummy. And also,
Okay.
about 3 times that I am passing some bowel. And doctor, yet another thing that I think I am a little bit constipated nowadays. I had to I have to put much strain to pass my bowel. This
Yeah. Yeah.
wasn't a thing like before. I was it was quite normal. First, I thought that it was due to my age, and also
Okay.
I told my GP. He thought that I am taking amlodipine. That is, said that it is somewhat
Mhm.
bloxidium, so
Mhm.
it may cause
Yeah.
this.
Yeah. Okay. You told that actually it's now a bit constipated, what you think. And you told that you noticed blood 3 times. And can you please tell me that was it fresh blood or was it mixed with your stool?
It was mixed with stool, and what it wasn't very significant amount, a little amount.
Okay. 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 That's all right. And can
Constipated
you please tell me that?
yes,
Yes. Can you please tell me how the stool looks like? It is hard, solid, or soft? Can you
hard.
please tell me?
Nowadays, this is
Hard.
almost
Okay.
every time it is hard.
Yeah, yeah. Do you feel any pain while doing your bowel work motion?
No, but I had to put muscle strain.
Yeah, yeah. Okay, and now you tell that. Can you please tell me then when did the last time you passed your bowel?
About 2 days ago.
Okay, and you also tell me there was some discomfort in your tummy. Can you please tell me where is that discomfort?
I cannot tell you exactly that where is the discomfort, but I feel overall discomfort in my tummy, especially after taking some food.
Okay, okay. And okay, okay. After taking some food, can you please specify that is there any specific type of food which makes it worse?
No,
Okay. And anything that makes you feel better about this bowel passage?
no.
Okay. And have you ever felt
Feels
any lumps
really
and bumps any lumps and bumps anywhere in your tummy?
no.
Okay. And okay. And may I come to some other things now that apart from hypertension, high blood pressure, do you have any other known diseases?
No.
Okay. And any other okay. May I know? May I have a look at your medication chart?
I am taking amlodipine only, doctor. I don't take any other.
Okay. Okay. Well, okay. Okay. And are you allergic to any medication?
No.
Any herbal medication?
No.
Any over-the-counter medication?
No.
Okay. I am just sorry to ask. It's just a personal question. Do you take any recreational medication?
No.
Okay. And well, may I know that do you have anyone in your family with any bowel cancer or any cancer?
One of my uncle had cancer in his bowel, and he needed
Okay.
surgery at his age of 60.
60. Okay. Any okay. And may I know that may I ask you some other personal questions that how is your dietary habit usually? Do you take a good amount of vegetables, fruits, or only some fatty or what about your meal?
I usually like to take less food and mostly I usually prefer meat diet and take
Okay, okay, okay.
less vegetable.
Yeah, 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 yeah. Well, now I'm going to ask some personal questions. Do you smoke?
I previously smoked, doctor. I am not smoking for about last 5 years.
Okay, very good. Do you drink alcohol?
Yes, doctor.
How many pints per day?
Maybe around 40 units a week.
Okay, that's actually very high amount. It's better than you stop drinking alcohol. And if you want, we can refer you to the alcohol cessation clinic. Okay.
Okay, doctor.
Okay. May I know that do you drive?
No,
Okay. Well, have you ever passed out? Like, have you ever lost your consciousness?
no.
Okay. And may I know that what you do for a living?
I'm a retired person. Previously, I was a solicitor.
Okay. Well, whom do you live with actually?
I am living alone, doctor.
Okay. So I think you need some support. Do you? Some social support or economic support, or are you well supported?
I can manage myself.
Okay, that's very well. And well, may I know what your concerns are?
Why I am having this, doctor? I am becoming lethargic day by day. Is it
Okay, well, let me ask you another question. Have you traveled to any other country recently?
no?
Okay, well, actually, at this moment, we will have to first examine it properly and also do some tests, and then we can have a better explanation for what for your symptoms. But as long as we have taken a history, I've taken history from you. It seems that there might be. I'm sorry to say that there. Okay, there might be chances of some. So there might be some causes behind it. However, I cannot rule out at this moment, but there can be some growth, some bad growth or some cancer, what we say, in your tummy region, in your bowel. So we are not actually sure at this moment, but it might be a cause that considering your symptoms. Okay, so we will have to first involve the bowel doctor or our consultant, and we will also run some tests and and at an emergency basis and get to you as soon as possible after getting the results. Are you getting me?
Yes, doctor. So you are thinking to take any camera test? I heard that it is very painful.
Well, actually, at this, okay, we might have to take a camera test of your bowel, but actually nowadays technologies have improved, and we can actually give good painkillers so that you might feel very less discomfort. Okay. And at the same time, actually, you have to. It's better that you have some lifestyle changes. Like actually, you have less um, fiber in your diet, so it's better that you have more fruits, vegetables, and soft types of foods. Okay, more fiber, and also it's very important for you to actually quit alcohol drinking. Are you with me?
Yes, doctor.
Yes. Do you have any other queries or questions?
Do I need admission?
Well, actually, we will at first uh, we will at first consult with our consultant and bowel doctor, uh, and we'll get to you about it, whether you need admission or not, as soon as possible. Is that all right?
Okay, doctor.
Okay. Any more other queries?
No, doctor. Thank you.
Okay. Thank you.
Your time were
Yeah. I just completed that too,
no problem.
since we are
What do
practicing.
you think?
Okay.
What is the cause of lethargy in this patient?
I think the cause of lethargy in this patient might be due to anemia, secondary due to uh, colorectal carcinoma. I think that would be my main diagnosis here. However, there can be some other differentials like inflammatory bowel disease, or inflammatory bowel disease might also be a cause. And since the patient has been hypertensive, I think it might be uh, ischemic colitis can also be a cause in this patient. Mesenteric ischemia.
Okay, angiodysplasia.
Yeah, angiodysplasia, mesenteric ischemia, diverticulous colitis, all can be causes here.
Okay, that's fine. So I will investigate him.
Okay, at first we will have to do some routine blood tests like CBC to look into the anemia, and also some infection like say increased AWBC. Then to look into the inflammatory condition, we will do for ESR and CRP. We will also go for blood culture, and at the same time we will go for urine routine microscopic examination and serum creatinine. And then we will have to go for we might have to go for a camera test. Like I think it will depend upon the decision of a gastroenterologist. That's whether colonoscopy with biopsy or sigmoidoscopy is needed in this patient. And also before that, we should have done a plain X-ray abdomen EP view. And we might also have to do some specific blood tests like fecal calprotectin to rule out inflammatory bowel disease, and also some cancer markers like CEA, carcinoid embryonic antigen, I think. And I think these, and also we might also do serum bilirubin, SGPT, SGOT, ALP, AST, those, sepothrombin time, those actually. And if and I think that's, and at times we might need to do CT colonography, CT angiography to exclude mesenteric ischemia.
Do you think occult blood test, CT scan of abdomen is
Uh,
needed?
yeah, CT scan. I told that CT scan of abdomen, and occult blood test they should have been done, and also stool culture and sensitivity.
Okay. Okay, this was fine. You, I think uh, consultant investigation for colonoscopy, it is likely that patient presented with all these symptoms. It is more likely that it is a chronic growth or chronic carcinoma. So I think at this stage, you can take decision that you can advise for colonoscopy.
Okay, okay, okay. Well, I think I missed sexual history here, so I just couldn't manage time it.
You can,
So this was important, I think, because CMV colitis can also be a cause, I think.
but nothing is suggestive of them like
Yeah. Not a subjective, but I think should have asked.
So for this gentleman, I think your history taking was good, but there was something that is this presentation for pieces of presentation. There was only on clue was given that is hemoglobin is less. So your first priority would have been to rule out that what is the cause of low hemoglobin first. After
Yeah,
you
yeah,
after you have went
yeah. Actually, I went for earlier things, other things earlier. So that I think that's a bad strategy.
for lethargic, when you have went for the review for lethargy and tiredness, then you could go for the what is the cause of low hemoglobin level. What are the
Yeah, yeah, yeah,
you got any history of passes of blood from mouth
yeah, yeah.
or from
Mm-hmm.
back passes or from anywhere?
Mm-hmm.
Then for reduced production, any signs of bruise, any easy bleeding, any recurrent infection, and also for cancer, any recurrent infection, any bruising. I think you haven't. Uh,
Mm-hmm.
and for a blood breakdown, any history of jaundice, any
Yeah, yeah.
you noticed any yellowish coloration of your skin,
Mm-hmm. Mm-hmm.
the pale color is too or uh,
Mm-hmm.
yeah, yellowish
This
color.
must have been this must have been asked because it might have been this might have metastasis. So I didn't ask that.
Yes,
So actually, hepatocellular metastasis is very common. So I should must have asked hematemesis, melena, jaundice, these things.
yes, and any previous history of jaundice, any previous history
Yeah,
of cancer, any there is certain exposure, any exposure to chemical, certain chemicals, any exposure to radiation. Though his history was fine that he was a solicitor, so
yeah, yeah, yeah,
certain chemicals.
yeah, yeah, yeah.
Okay, otherwise your history taking was fine, and you lost most of the time by asking those systems.
Other, yeah,
And
yeah, yeah. So okay,
after that, when there is no signs of blood loss,
yeah.
low blood production, or
Mm-hmm.
down of blood, then you could go for any other system symptoms like any low intake, especially
Yeah, yeah,
severe
yeah.
alcoholism.
Mm. But dietary habit, I asked. I think that was right or not? Is
Yes,
dietary
that
habit?
is a bit important.
Okay, okay,
Okay, and otherwise,
okay. I
otherwise,
don't think it was very good because actually I just got lost in excluding other things.
it's fine. Just one thing that you messed up is asking those thing at very earlier stage.
Those were a bit unnecessary. Yeah, yeah. Actually, I should have just gone to it at the beginning because I think that most probably bowel condition is very much common in anemia in these patients or some lung cancer or renal cancer. I think these should
Even
have
not
excluded.
even not in these patients. There was a given that so your main uh, 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 main thing to discuss or main thing to explore was causes of low hemoglobin for this gentleman.
Yeah, yeah,
Is it
yeah,
even it is a case of CKD or carcinoma?
yeah, yeah. So that was actually okay. So actually that was a